science major from Leonardtown, Maryland.
And I'm Maeve Perrin, an Equine Industry and Management major from Midlothian, Virginia. Today, we are going to be talking about air quality in stables
And respiratory diseases.
Do you ever think about dust? What we call dust is actually comprised of many different things. There is organic dust, which comes from living organisms. Those are things like mold, fungal spores, bacteria, dust mites, plant pollen, animal dander, and other microbes and things like that. There's also inorganic dust. Inorganic dust is pretty much just dirt and other minerals. Some dust even contains insect parts and manure. Gross. So when we use the word dust, we generally use that to refer to everything all together, like you see here. But the word dust technically only refers to the inorganic portion. When you're talking about everything mixed together, when it's settled like this, or especially in the air, that's called airborne particulate matter, or air particles. In addition to knowing what air particles are comprised of, it can also be helpful to know the sizes of air particles. Knowing the sizes can help us to know where in the horse's respiratory tract is going to be most affected by the dust that they're breathing. So when we are measuring the sizes, we measure them in units called micrometers. These are micrometers, and these are tiny, tiny measurements. I'm sure you've all seen dust floating through the air, like in a sunbeam from the window or something like that, and you know that dust particles are super small. Well, the smallest ones are so small that they are really microscopic and we can't even see them in the air. So the sizes are called fractions, like fractions of a whole. So the first size that we talk about is called the inhalable fraction. These are dust particles that have a diameter that measures less than 100 micrometers. These are the particles that the horse inhales. So it's kind of a broad category of everything that the horse is inhaling when they take a breath. These particles are further broken down into other categories. The first category is the extrathoracic fraction. The extrathoracic fraction are the particles that are between 10 and 100 micrometers in diameter. This fraction is the largest of the air particles that the horse inhales, and these don't tend to get very far into the horse's respiratory system. They tend to stop in the nose or mouth where they get stuck in the mucous membranes. Then the next fraction size is the tracheobronchial fraction. The tracheobronchial fraction go a little bit farther. These are between 5 and 10 micrometers in diameter, and they don't get super deep down into the lungs, but they can get, past the larynx and into the trachea. Then there is the respirable fraction. The respirable fraction are less than 5 micrometers, and these are the ones that can get all the way deep into the horse's lungs, all the way to the alveolar sacs. And the respirable fraction are the dust particles that can cause the most damage to the horse's lungs and can cause the most inflammation when they get all the way down into the horse's lungs. These smallest fraction yet are called ultrafine particles. These ultrafine particles are smaller than 0.1 micrometers. 0.1, that is super, super microscopic. It's so microscopic that when the horse inhales these ultrafine particles, not only do they get all the way down into the alveolar sacs, but they can also cross into the alveolar sacs the exact same way that oxygen does. That's how small they are. In addition to telling us where in the horse's lungs will be affected by each particle size, the particle sizes also dictate how long those particles will remain suspended in the air. Larger particles are a little bit heavier and tend to fall to the ground or settle on a surface more quickly than do the smaller particles. smaller particles are lighter and are more likely to be held in the air by air currents and will stay floating around for longer. This can cause issues because, as we mentioned, it's these smaller respirable and ultrafine particles that can cause the most damage when they're inhaled by the horses. But in addition to causing the most damage, these are the ones that are staying in the air longest, which is why it's really important to try and limit the dust that's in your horse's environment, because the dust that they're inhaling will be mostly these smaller fractions, which can cause the most damage if inhaled. Here I have a little demonstration to illustrate what we've been talking about. So I'm going to take this bag and I'm going to put I have all these different types of glitter that are going to represent different sizes of air particles. So we know that air particles tend to clump together and travel together. So I'm gonna put everything in this bag together. So we have some bigger sequins. So these are gonna represent the extrathoracic fraction. And then some of these little confetti glitters are gonna be our tracheobronchial fraction. Then I have these smaller pieces of blue glitter. That can be our respirable fraction. And even smaller yet, we have this super tiny gold glitter will be our ultrafine particles. So we'll toss those on in there. We'll mix them together because air particles all travel together. So everything in this bag right now is representing the inhalable fraction. So 100 micrometers and smaller. But you can see how they're all different sizes. All right, so I'm gonna try and pour it out all at one time and we'll see where it goes in the breeze. Okay, so I'm sure that was hard to see, but if you can tell just kind of looking where the glitter landed. So we had a little bit of a breeze that was blowing and all of the larger particles, so the sequins all landed right on the plate where they were poured out. And most of the sort of purple confetti ones stayed on the plate as well. There were some that came out this way. And there were even more of our blue that were in place of the respirable fraction. And then the ultrafine particles, the little gold particles, are all over the table over here. They really blew the farthest. So what this means is that the smaller particles were carried through the air and stayed in the air longer and were carried farther than the larger particles, which settled much more quickly. So hopefully this just gave you a better understanding of how the different sizes of air particles can influence how long they stay in the air and how far they travel.
Now that we've gone over the different particle sizes, we wanted to give you a homemade example of the respiratory tract to give you a little visual of where these particles actually go in the respiratory system. Starting over here with the green funnel, we have the nostril, up to the larynx, down the trachea, into the lungs, and here the straws signify the bronchioles, and they lead into the alveoli. Now, as Maeve mentioned before, there are different particle sizes. We wanted to represent that with different pom-pom sizes. So the ones that stay in the nostrils are only the extrathoracic fraction. They get stuck in the mucous membranes in the nostril and mouth. The next size, that's the next smallest, is the tracheobronchial fraction. These can travel through the trachea, but they stay only in the trachea. They are too large to go into the lungs. The next size up is the respirable particles. They make it into the lungs and alveoli, but they don't make it into the alveoli as easily as the ultrafine particles that you can see in these as the two little dots. And they can make it into the alveoli just like oxygen. The inhalable fraction includes all of the different particle sizes. It is an umbrella term for all the particles ingested by the horse. So try to keep this diagram in mind when we move on to the next section about different respiratory diseases. So now that we've talked about the respiratory tract and different air particles that can affect it, I wanted to go into a little bit of detail about 2 different respiratory diseases and how to go about diagnosing them. If you walk out and you find your horse with any type of respiratory symptom, such as a runny nose, a cough, any type of runny eyes, something of the sorts, you should definitely try to figure out what could be the cause of it. The first thing you should do is take a temperature of your horse to make sure it's not anything more serious, such as an infection or sickness that the vet needs to come take a look at right away. The next thing you should do is think about a few important questions, such as, is the hay that they're eating new? Are they involved in any environment that's a little dustier than usual? Or is their hay smell a little musty, or does it smell sweet like it should? If any answers to these questions prove to be a little alarming, it's not a bad idea to call your vet or call someone who would know a little bit more to figure out what could be the cause of the problems. If your vet does come out, they may want to listen to your horse's lungs and see if they hear anything unusual, or they may want to do an x-ray or ultrasound or any of the other diagnostic testing used to diagnose respiratory diseases. The first disease I wanted to talk about is inflammatory airway disease, also known as IAD. This disease normally affects younger horses but can affect any horse at any age. A key symptom of this disease is that at rest they seem completely normal, and then it's when they are asked to work that they cough or maybe exercise intolerant. The cause of the inflammation in their airway is still being researched. However, there has been a link to the particles in the air that they inhale. The agents that the horse inhales will cause a disruption in the inflammatory cells of the horse's lungs, creating inflammation in the horse's lungs and excess mucus in the horse's airway. The good thing about this disease is that it is curable and your horse can revert back to normal life as soon as it is fixed. The next disease I wanted to talk about is recurrent airway obstruction, otherwise known as RAO. This disease does have a known cause, which is hypersensitivity to particles inhaled by the horse, which causes inflammation in their lungs specifically. It's similar to allergies in humans.
Due to this inflammation, the horse will have to put more effort in breathing out, which will cause the disease-specific heave line on the abdomen of the horse, as shown in the picture.
Other symptoms of this disease include coughing, exercise intolerance, and flared nostrils. This is different than IAD due to the fact that the horse can experience respiratory distress even at rest. It is also different due to the fact that it cannot be cured. However, it can be treated throughout the horse's life. Different things such as constant turnout, watering down of hay, and great ventilation can help a horse breathe better with cleaner air quality. There are other things such as systemic corticosteroids and bronchodilators, which are different forms of therapies to help with respiratory diseases. All of these practices are especially important during the winter and spring months due to the fact that the particles in the air that cause these diseases are at an all-time high.
Remember, if something seems wrong with your horse, always say something. It's never a bad idea.